Our main focus is on diabetes. We have, over the last 20 years, been involved in the development of a wide range of new treatments in diabetes, trying to find out how they work, where they work best in. We're very interested in cardiovascular disease in diabetes and heart patients, and strategies to reduce their risk of a second heart attack. We've been actually very successful at that. We now have several treatments on the market which we have played a role in developing. We have reduced the number of strokes, amputations, heart attacks, blindness very dramatically. We are currently working on new treatments to prevent dialysis and kidney failure, new treatments for type 1 diabetes. We are working on ways to assess glucose control a little better than what we've done in the past with a variety of new tests. And we're trying out some cutting edge things. We were among the first to have a trial of stem cell therapy in type 2 diabetes. Most of our focus is on type 2 diabetes. That's what affects the vast majority of patients, particularly down in the south, where we also have a lot of obesity. So we're working on strategies that might help diabetes and weight loss together. Part of our aim is to prevent some of the long-term complications, including heart attacks, etc. A big driver is obesity and physical inactivity. And along with that, you tend to get high blood pressure, high blood sugar, and high cholesterol. So we try to focus on ways to reduce all those three things, and then to look beyond that at what else we can do to improve the risk. And there are things that are, very individualized. We are in women, for example, what kind of hormone replacement therapy might do that, rather than the kind of approach we've used in the past. And the same in men. There are other approaches that might help with making them fitter, improving general health, not just cardiovascular disease, and also helping diabetes. And that gets into the what we would like to call personalized medicine. We're looking at ways that we can treat an individual different from everybody else, because they're individuals. And that is a little art, but we're trying to put some science to it. We are working a little bit with PCSK9 inhibitors. We're really waiting for the large cardiovascular outcome trials with that. The drugs are available on the market. They're expensive, and we're trying to find where they would be most useful. There are a wide range of approaches. I think certainly lifestyle change is at the heart of it. You really need to find ways to exercise while having fun at it. Exercise shouldn't be a chore. You should enjoy what you do. Healthy diets are very possible. They can be tasty and healthy. We work with Dr. Harlan in the teaching kitchen to, hopefully teach people how to effectively eat well and eat healthy. And there are a number of other choices there in that respect. There are medications which have some challenges of their own, because if you stop the medication, you regain the weight. So we have to work with lifestyle into the medication approach. And finally, bariatric surgery. They play very different roles. Cardiologists focus on just the cardiac patient mainly. We are focusing on preventing your need to go to a cardiologist, if you like, and sending the appropriate patient to them. In the long run, we work on essentially risk factor reduction in an optimal kind of way. There are some people who have symptoms from heart disease. They really need to see a cardiologist. We see a lot of asymptomatic people and prevent a lot of people with diabetes from having heart attacks. The rate of heart attacks has dropped quite substantially, including that in people with diabetes.